Welcome to NurseEd Academy by Dr. Ju Utterwet. This video we will explore the clinical reasoning cycle, a structured framework that helps nurses make informed and effective clinical decisions. What is the clinical reasoning cycle? The clinical reasoning cycle is an 8-step process that guides nurses in assessing, planning, and evaluating patient care. It ensures logical and thorough decision-making. Let's look at each step. Step 1. Consider the patient situation. Begin by understanding the patient's situation. This includes gathering basic details like their age, condition, and reason for care. Example: you're caring for a 75-year-old admitted with shortness of breath. Step 2. Collect cues information. In this step, gather new information, including both subjective and objective data from assessments. This involves performing a primary assessment followed by a secondary assessment that incorporates body systems and/or focused assessments. Additionally, vital signs, lab results, and the patient's medical history are collected. Example: the patient's oxygen saturation is 88%, they have a history of COPD, and they report increasing fatigue. Step 3. Process information. Analyze the cues you've collected. Identify patterns, compare findings to normal ranges, and prioritize what is most concerning. Prioritizing issues will be linked to the primary assessment A to E and/or the secondary system-based assessment. Example: shortness of breath and low oxygen saturation indicate respiratory distress. Step 4. Identify problems issues. From the processed information, determine the key issues affecting the patient. In this step, you will be able to make judgments based on a comprehensive nursing assessment, which is the phase for identifying nursing diagnoses. Example: the main issue is respiratory compromise due to an exacerbation of COPD. Nursing diagnosis can be ineffective airway clearance related to increased bronchial secretions and decreased lung elasticity secondary to COPD exacerbation, as evidenced by dyspnea, wheezing, and ineffective cough. Step 5. Establish goals. Set specific, measurable goals for patient care. This step involves creating a nursing care plan, where you can set goals using the SMART framework: specific, measurable, achievable, relevant, and time-bound. More details about this framework can be covered in another lecture. Example: improve oxygen saturation to above 92% and reduce shortness of breath within the shift. Step 6. Take action. Implement interventions based on your goals. Actions may include administering oxygen, medications, or repositioning the patient. Example: start oxygen therapy and bronchodilators as prescribed. Step 7. Evaluate outcomes. Assess whether the interventions achieve the desired outcomes. Example: recheck the oxygen saturation and reassess the patient's comfort. Step 8. Reflect on the process. Reflect on what went well and what could be improved for future care. Example: was oxygen therapy initiated promptly? Were the patient's concerns adequately addressed? After reflection, the cycle begins again, starting with Step 1, understanding the patient's situation. The clinical reasoning cycle is critical for delivering safe and effective care. It helps nurses make logical decisions, prioritize patient needs, and reflect on their practice. By mastering the clinical reasoning cycle, you'll enhance your ability to assess, plan, and deliver patient-centered care. Don't forget to subscribe for more nursing lectures and resources.